Nutrition in Older Adults for the Nurse Practitioner. Welcome to the Education module, Nutrition in Older Adults. In this module, we will address common issues in nutritional support for older adults. Nutrition has a significant impact on health and quality of life, as well as being essential for adequate energy and function. The purpose of this module is to discuss the impact of nutrition support on the well-being of older adults. The process of aging affects the ability of older adults to achieve adequate nutrition. Changes in physiology from the loss of olfactory sense, decrease in sense of taste, compromised dentition, from the loss of decreased saliva, decreased gastric acidity, lactose intolerance, decreased intestinal mobility, and constipation all affect the nutritional status of older adults. Older adults are at risk for malnutrition due to physiological, psychological, social, dietary, and environmental risk factors. Older adults are particularly at risk for inadequate nutrition and malnourishment. Older adults are more likely to have multiple chronic conditions that place them at risk for malnutrition. Older adults with food insecurity can lead to malnutrition and poor outcomes as well. Nearly 5.3 million adults over the age of 60 were food insecure in 2018. That is 1 in 14 seniors. Malnutrition negatively affects quality of life, increases healthcare costs, and increases the risk of short-term mortality. Malnutrition has many warning signs, including muscle weakness, fatigue, depression, increased illness or infection, unintentional weight loss, and decreased appetite. Weight loss in older adults is often associated with loss of muscle mass and can ultimately impact functional status. Obesity also affects functional status and can cause or exacerbate chronic health conditions such as hypertension and heart failure. Malnutrition in older adults is associated with increased morbidity and mortality. The progression to malnutrition is often insidious and goes undetected. The Mini Nutritional Assessment Form is one screening tool used to identify older adults who are malnourished or at risk for malnutrition and consists of 6 items covering food intake, weight loss, mobility, psychological stress or acute disease, presence of cognitive impairment or depression, and the measure of body mass index. The National Institutes of Health recommends older adults to maintain a BMI between 25 and 27. However, the BMI should be used cautiously with older adults as a single indicator of malnutrition. The BMI assesses for weight and height, but it does not account for body mass composition, such as fat or muscle. Dehydration is common in older adults. Primary signs of dehydration include skin turgor tenting, sluggish capillary refill, and deep dry tongue furrows or dry mucous membranes. Health literacy is an important predictor of food label use, which positively impacts dietary quality. Individuals with low health literacy have significantly lower use of food labels than those individuals with higher level health literacy. So, if we expect patients to read labels for nutrition, we need to help them do that and consider their health literacy rate. Strategies to enhance health literacy and food label use should be developed to improve dietary quality and health outcomes. In a systematic review of oral health assessment by nurses and others in the care of cognitively impaired individuals, the Kaiser-Jones Brief Oral Health Status Examination was found to be the most comprehensive, validated, and reliable screening tool available. The 10-item rated BOS rates oral health problems with higher scores, identifying more problems. The BOS assessment begins with observation and palpation for enlarged cervical lymph nodes and induces a complete oral cavity evaluation. Using a pen light, tongue depressor, and gauze, the conditions of the oral cavity surrounding the tissues and natural artificial teeth are examined and categorically rated from 0, which is normal, to 2, which is significantly problematic. There is no single parameter that is definitive for malnutrition in older adults. The consensus statement of the Academy of Nutrition and Dietetics, American Society for Parental and Enteral Nutrition on the characteristics for the identification and documentation of adult malnutrition recommends identification of 2 or more of the following characteristics for diagnosis: insufficient energy intake, weight loss, muscle wasting, subcutaneous body fat wasting, presence of edema, or diminished grip strength. Biochemical indicators are no longer seen as best practice for identifying malnutrition. Albumin once was a popular method of evaluating visceral protein status, while prealbumin is negative acute phase proteins. Therefore, a low albumin or prealbumin may be indicators of inflammation and illness rather than measures of nutritional status. Prevention of malnutrition should be a priority for nurse practitioners working with older adults. Diet and physical activity are a fountain of youth and promote longevity and an active lifestyle. According to the U.S. Department of Agriculture, older adults require an estimated 25 to 30 kilograms per day to meet daily energy requirements. Of those calories, 45 to 65% should come from carbohydrates, 20 to 35% from fats, and 10% to 35% from proteins. A lower estimated protein for those with renal or hepatic insufficiency would be 0.8 to 1.5 grams per kilogram per day. It is important to provide older adults with nutritional resources, such as My Plate for older adults. My Plate is a visual comparison chart of a plate that highlight the color, amount of foods that fit into a well-balanced diet for those 50 years and older. A greater percentage of adults over the age of 50 years are consuming nutrient-empty calories. Since most older adults are consuming less nutrient-rich foods, other preventive nutrients that may be needed for the older adult include calcium, vitamin D for bone and teeth, as well as there is evidence that vitamin D is beneficial for cardiovascular, respiratory, endocrine, nervous, and immune systems. B12 and folate for DNA synthesis and erythrocyte production, and fiber for glycemic control, reducing cholesterol, increasing stool bulk, and decreasing transit time. Dehydration can result in constipation, fecal impaction, cognitive impairment, further functional decline, delirium, and even death. A decrease in fluid consumption can be a direct result of the decline in the older adult thirst sensation, forgetfulness, or result from a fear of incontinence. Food intake can be improved by catering to food preferences and avoiding therapeutic diets with no known clinical value. Preparing individuals for meals with hand washing and good oral care, and ensure proper positioning. Set up a pleasing environment conducive to eating a meal. Use herbs and spices to compensate for diminished sense of taste and smell. Avoid rushing through a meal. Offer fluids at every contact with older adults. Provide reminders and cues for drinking fluids. Avoid caffeine and sweet fluids. Conduct a medical review for necessity safety, potential risks, adverse events, and nutrient interactions. Provide a Meals on Wheels referral whenever possible. All older adults qualify for Meals on Wheels through Title III of the Older American Act. A short course of appetite stimulants may be useful. Mirtazapine, used off-label at bedtime, enhances serotonin by way of antagonism of the 5-HT receptor. Caution is required for dosages 15 to 30 milligrams per day because of hepatic and renal insufficiency, and more non-androgenergic and serotonin effects, some of which may counteract the appetite stimulatory effects. Cyproheptadine is a serotonin and histamine antagonist that may enhance appetite and must be used cautiously due to the potential for a confusion in older adults. Appetite and weight usually improve with megestrol acetate. Megestrol acetate is on the Beers list. Due to nursing home populations, it has been associated with a higher risk of deep vein thrombosis, fluid retention, edema, and exacerbation of congestive heart failure. There is a strong Beers list warning to avoid prescribing this agent. Dronabinol can stimulate appetite, but it is associated with somnolence and dysphoria in older adults. Human growth hormone is an anabolic agent which induces preferential usage of carbohydrates and fats while preserving proteins and increasing muscle mass. However, there are no significant improvements in strength, function, or reduction in fractures, and may lead to hyperglycemia and fluid retention. It is contraindicated for individuals with cancer. Summary. To sum up what we have briefly gone over in this presentation, nutrition impacts health, disease, well-being, and quality of life in older adults. Malnutrition is common in older adults, and prevention is the key to managing nutritional issues. Thank you very much for listening to this webinar. If you are interested in learning more about older adults, you may want to check out the Neuropsychiatric Symptoms of Dementia video series. Thank you.